A looming crisis threatens to reverse decades of progress in the fight against malaria, potentially leading to the deadliest resurgence ever. A new analysis paints a grim picture. Slashed funding for anti-malaria programs could unleash a wave of the disease, costing millions of lives and billions of dollars by the end of the decade. The report highlights a confluence of threats. Extreme weather events and humanitarian crises are increasing the number of people exposed to malaria. At the same time, the parasites and mosquitoes that carry the disease are developing resistance to existing insecticides and drugs. Gareth Jenkins of Malaria No More UK emphasizes the stakes. Cutting funding risks the deadliest resurgence we've ever seen. The economic impact on sub-Saharan Africa would be substantial, prompting leaders in the region to appeal to the G7 nations to maintain their investments. They are also seeking support from the private sector and high-net-worth individuals, recognizing that controlling malaria is key to economic growth and trade. Joy Fumafi of the African Leaders Malaria Alliance, ALMA, highlights the commitment of African nations. African countries are stepping up to the plate, and we are appealing to the rest of the world to accompany us on this journey, because all of us need to be part of the end story of malaria. But here's where it gets controversial. The report specifically examines the potential consequences of funding cuts to the Global Fund to fight AIDS, TB, and malaria, which provides nearly 60% of all international financing for malaria control measures like mosquito nets and preventative drugs. If funding is 20% lower than in the last round, researchers predict an additional 33 million cases, 82,000 deaths, and a loss of $5.14 billion in GDP by 2030. And this is the part most people miss. The situation could become far worse. If funding collapses entirely, leading to a complete breakdown in preventative measures, the report estimates a staggering 525 million additional cases, 990,000 more deaths, and a loss of $83 billion in GDP. Tragically, approximately 750,000 of those deaths would be children under 5, representing a devastating loss. Conversely, the report offers a brighter outlook if the Global Fund receives the full $18 billion it's requesting. This could lead to a $230 billion boost to GDP, 865 million fewer cases, and 1.86 million fewer deaths. Fumafi notes an increase in domestic budget allocations to malaria control in African countries. However, she stresses the need for significant funding to meet the challenges ahead. African nations, already burdened by debt and the economic fallout of COVID-19, are also grappling with a rise in non-communicable diseases like diabetes and cancer. While some donor countries are considering reducing their pledges, Fumafi acknowledges the substantial commitment of countries like Germany, which pledged $1 billion. She hopes that wealthy individuals, the private sector, and foundations will step in to fill the funding gap. Nigerian businessman Aliko Dangote emphasizes the economic impact. Malaria is not just a health crisis, it is an $83 billion brake on Africa's growth and enterprise. Business cannot thrive in sick communities. The economic impact of malaria is measured by factors like disrupted schooling, employee absences, and the impact on tourism and agriculture. What do you think? Are you concerned about the potential resurgence of malaria? Do you believe wealthy nations and individuals have a responsibility to increase funding? Share your thoughts in the comments below.